Hi, Paul Slatkus, Good News Planet. I'm speaking to Dr. Wesley Clark. Hi, Doctor. How are you?
All right. How are you?
Okay, good. Director of the Center for Substance Abuse Treatment under the Substance Abuse and Mental Health Services Administration, United States Department of Health and Human Services. And we're going to talk today about, I guess, a real concern here, which is called inhalant abuse. And you have some new data here about inhalant abuse, and it's good news to know about it, but it's not good news probably for people to abuse anything, right?
It's not good news for people to abuse anything. And the news that we're releasing today is that adults represent a majority of the inhalant treatment admissions and the majority of inhalant misusers. People often think of inhalants as something that our adolescents do. In fact, we are concerned about that. But we also realize that we need to remind those over the age of 18 that in terms of admissions and in terms of use, we have an estimated 1.1 million adults over the age of 18 who use inhalants in the past year. And by contrast, that's higher than crack cocaine. There are a little less than 1 million people using crack cocaine. LSD, 637,000. Heroin, 571,000. PCP, we estimate 75,000. So inhalants represent a larger problem in terms of our national survey on drug use and health. When we look at the people who are admitted to substance abuse treatment for inhalant use, 54% or slightly more than half are over the age of 18. And the largest proportion, or 52% of those, are between the ages of 18 and 29.
Dr. Clark, you're a medical doctor, you're a lawyer, you studied chemistry, so on and so forth. Please explain what actually is an inhalant.
Inhalants are a range of substances from correction fluid, gasoline, glue, anesthetics like halothane or nitrous oxide, spray paints, aerosols. And for adults, we like to highlight two specific inhalants, amyl nitrites or poppers, and nitrous oxide, otherwise known as whippets. These are the little cylinders that are whipped cream chargers that can be purchased, and people use those. So the poppers people use in association with sex, and as a result, it decreases people's awareness, and they engage in high-risk sexual activity. The whippets, the nitrous oxide, but the other substances like gasoline, I think people know what that's for. Glue, shoe polish, toluene, and other compounds. So these are compounds frequently found in the garage, in the workbench, under the sink, used for cleaning or other commercial or industrial household purposes, but not for human consumption. And so our concern is because of the ready accessibility that we need to alert people that these substances, although ubiquitous in your environment, are not designed for human consumption.
You mentioned something. You said you know what. Actually, I hardly know what any of these are used for, except for what they're supposed to. I thought be used for. You said gasoline. I mean, did I hear that right?
Yes, gasoline. Yeah.
I mean, someone takes gasoline, they put it like you would use for a lawnmower, and you take it and you put it on something and you sniff it.
Yeah, you put it on a rag, you huff or sniff it. Yeah, that's exactly the point. Intentionally inhaling a chemical vapor to get high. They can produce obviously life-threatening conditions, including stopping your heart. Some of these inhalants can produce irreversible damage to your brain, kidneys, liver, lungs. People are using it for the mind-altering effects, but in fact what they don't recognize is that it's playing Russian roulette with substances that are not designed for human consumption. They're designed for other purposes. And the fact that you can, quote, get these mind-altering effects doesn't nullify the other toxic effects that they have because they're not designed for human consumption.
So can somebody, in essence, do people die from this?
Yes, there is a syndrome known as sudden sniffing death, where you get your heart simply stops even though you've used it before. There are other people who have died from it. You get dizzy, lose consciousness. You're driving a car, your car crashes, and depending on the substance, these are things that you need to be aware of. Other substances, because of the huffing, sometimes involves like putting a bag up. Some people put plastic bags over their head so they can inhale the vapors more completely, and they wind up suffering from anoxia, lack of oxygen. And of course, you need oxygen to live. And if you cut off your supply of oxygen because you're more interested in the vapors, you also die. Some people hijack nitrous oxide in medical tanks, and we had we had 2 people die several years ago who had 100% nitrous oxide in a hermetically sealed mask, and they put the mask on, and they were breathing 100% nitrous oxide. Obviously, that was incompatible with life because you need oxygen.
Jeez. So if someone, what are some things that somebody can do, loved ones around somebody like this? How do you suggest people to help other people in this regard?
Well, I think we start off with recognizing the hazards associated with these substances. We also recognize that the substances, despite the so-called mind-altering effects, may be having their effect in toxic ways. So we're embarked on a public education campaign and figuring out different ways to present that information. For adolescents, parents can use today or opportunities that they find in the media to educate their children as well as they're educating themselves. The first thing we do is not say, not my child, not the people in my environment. We should be talking about these things. And we know that our young adults tend to be in the high-risk taking age range, so we need to point that out, that this is not a risk that's worth taking.
Mm-hmm. Let me ask you, we're doing a project with something called Text for Baby, which is actually part of what the Health and Human Services Organization, I know, has some connection to it as well. This is for pregnant mothers. How about pregnant mothers and this inhalant concern? Terrible, right?
Yeah, I mean,
the worst of the worst.
Well, it's bad for everyone. So, because sometimes young women don't know they're pregnant until their second trimester. So obviously, it's not a good thing for them either, nor is it for their fetus. So, if our objective is to get people not to start, and if they started, not to continue, because as you point out, it creates problems. Not only for the mom, but also for the fetus. So, again, another reason to get the word out, get the education out, and if people develop a dependence, to get them in treatment.
Okay. Anything else you'd like to share at this moment? I know you have a busy schedule, letting the world know about this.
Oh, no, I appreciate you taking the time to share this information with your audience.
Okay, Dr. Clay. Well, then let me ask you this. What's good news for you?
Well, the good news is that you're willing to share this with your audience.
Okay, my friend. All right. It's always a pleasure to speak with you, and thank you for all the good work you've done. You've done a lot of things, and writing, and we appreciate it because it's all about helping other people. Take care, Doctor.
Thank you.
All righty. Bye-bye.
Bye.